From Faith Forward Media, this is Healthcare Musings. I'm Dr. Hassaballa. Welcome to Healthcare Musings, everybody. Happy to have you with me. Continuing on in the series AI and Medicine. This time, I wanted to comment on an article that I found in the New York Times that talked about, quote, Dr. ChatGPT, unquote. The article, it was published November 16th, 2025, and it's entitled, Frustrated by the Medical System, Patients Turn to AI. And the subtitle is, Chatbots are cheap, always available, superficially empathetic, and sometimes wrong. Some have concluded they're a risk worth taking. This was written by Teddy Rosenbluth and Maggie Astor, again, in the New York Times. I get it. Yeah, I had my episode with Ayman Abdul-Munam, who's, he's not a doctor, he's healthcare adjacent, but he's in the AI space, and he told me, and I've taken it to heart, and it's actually helped. He told me he would much rather have a doctor with an AI chatbot than without. And if it can make me a better diagnostician, why not? And I fully believe it. In fact, I had a very challenging case, and I had an idea, and I asked a chatbot that's trained. The LLM was trained in the medical space, and it further solidified the idea of the diagnosis in my mind, and it ended up being right. That was the diagnosis. We treated the patient, and he's better. He's better. So, wow! If it makes me a better doctor, why not? Why not use it? And still being the human in the loop, as Eamon said. And at the same time, you know, again, frustrated by the medical system. I get it. I love my primary care physician. He's great. He's well trained. He's smart. He cares. When I go see him, he takes his time. And sometimes I want to ask him a question and I send him a message, and it takes a little bit of time for him to respond. He always responds. It's a thoughtful response. It takes some time, and I don't begrudge him for it. He's super busy. There's tons of things. He takes his time with his patients. There are tons of things that primary care physicians have to do nowadays, and the notes and writing and getting back and patients sending messages and everything. Uh, um, I get it. It takes a long time. I don't begrudge him at all. And still, I want the answer now. I don't want the answer in 2 days or 3 days. And that's me. And I'm a doctor. I'm sympathetic, and I understand. And patients, again, do not have that same understanding. They don't know what it's like to be a primary care physician and how busy and how difficult the job is. They don't understand, and so they talk about this retired lawyer in Los Angeles who, sent a message to her doctor, and the response. And here I'm quoting the article. Quote: "The response left her feeling that the doctor hadn't read her question or even her chart. The doctor offered generic advice: stop smoking, in parentheses, she doesn't smoke, avoid alcohol, she doesn't drink, exercise regularly, she works out 3 times a week. Most infuriatingly, she was advised to eat adequate protein to support bone health. No specifics included," end quote. And so, frustrated, she went to ChatGPT, and it gave her a very detailed answer, right? And then the article goes on and on about other people who use ChatGPT um, for medical questions. And because again, they're very frustrated with the medical system. It takes forever to see a doctor for a doctor to answer. And then when the doctor does answer, sometimes it's a very cold response. I talked a while back. I'm not sure if I wrote an article or did a podcast episode or maybe, an oral, like an audio, episode about the fact that they did research where they compared human physician responses to patients I think in an EMR compared to an AI chatbot. And the AI chatbot scored much more highly in the empathy range. It's very empathetic. And that's a problem. That's a problem. The doctor's answers were curt. They weren't very caring. And I told that this is a cautionary tale. Um, and, and, uh, and so the article talked about uh, how some people are alarmed because these chatbots can be wrong, right? They can be trained, like they can give you wrong answers. And my friend Eamon told me the story, but he did something differently. He uploaded the entire medical record of his daughter into he uses Claude to give it context. So when he asks the medical questions, it has all the context. A lot of these other chatbots and these AI tools don't have that kind of context, and so they can give you wrong information, right? Um, and uh, and that could be a major problem. Um, Not only that, here's a thing up in the article. It says, one of the subheading: "My doctor is busy, but my chatbot never is." Again, and here's what they say: "Quote: ChatGPT has all day for me. It never rushes me out of the chat," she said. And before that, it says, while the doctor seems to I'm quoting now, quote, "While the doctor seems to quickly go restless as the 15 minutes allotted to her tick down, the chatbot has limitless time," unquote. Right? I mean, like, I can't begrudge the doctor. It's not necessarily his or her fault. They are forced to see that many patients in a day in order to generate the revenue they need to earn a living. Or if they're employed so that they can, you know, pay the bills and cover the overhead, or if they're in private practice, again, to cover the overhead. It's very hard. Unless you're in concierge medicine where you're paying a monthly fee, and sometimes not exorbitant, extravagant, extraordinary monthly fee to have the doctor be able to limit their patient base and spend as much time as he or she wants with you. It's very difficult. But these chatbots have all day. You can ask it 100 times and it won't get sick. But if you send your doctor 100 questions, right, it's going to be it's going to be problematic. I don't begrudge the patients, and I don't begrudge the doctors. The system is a problem, and the fact that these patients are turning to AI chatbots, it just highlights the problem of the system, where doctors are super busy and they don't have a lot of time, and and then patients need. I'm a patient, and they want an answer now, and you have a chatbot that's right here, and a doctor that could take 3 days. It's the path of least resistance. A lot of people are going to use the chatbot, and I don't begrudge them for it. I get it, and I mean the whole thing about this article that made me want to kind of talk about this is, like, what do we need to do? What are the solutions in order to um, in order to fix this problem, because it's only going to get worse with time, right? And the AI chatbots are going to get better. Their training is going to get better. And so there's this part of the article that says, the subheading: "The Doctor versus ChatGPT." And so, uh, you know, and this is also a cautionary tale against these chatbots. Let me quote the article here. Quote: "Dr. Benjamin Tolshin, a bioethicist and neurologist at the Yale School of Medicine, recently consulted on a case that stuck with him. An older woman was admitted to the hospital with difficulty breathing. Believing that fluid was building up in her lungs, her medical team recommended a medication to help flush it out. The patient's relative, however, wanted to follow ChatGPT's advice: give her more fluids. Dr. Tolchin said that doing that could have been dangerous, quote, dangerous or even life-threatening, unquote. After the hospital declined, the family left in search of a provider aligned with the chatbot. They didn't find one at the next hospital, which also declined to give more fluids. Dr. Tolchin said he could imagine a time in the, quote, not so distant future, unquote, when models are sophisticated enough to provide reliable medical advice. But he said the current technology didn't deserve the level of trust some patients put in it, unquote. See, this is very dangerous. Um, Again, most people are not going to be like my friend Eamon, who puts his entire medical record and history in the AI tool as context, right? And so this is very scary. If the patient has fluid overload, you can't give more fluids. That really is life threatening. Um, and so so what do we do about it? Okay, we've identified the problem, right? We have to be at, like my friend Dr. Omar Latif says. I'm paraphrasing. You have to be the second paragraph a person. Okay, what are the solutions, right? What are the what what do we need to do? Um, I think medical systems, employers, hospital systems have to figure out how to relieve the burden of their clinicians, especially their primary care physicians. We have to figure out a way how to give them more time. And ironically, it may be an AI ambient listening tool where they can just sit there and talk to the patient with the listening tool sitting and gathering the details of the visit and then helping the physician with their documentation, right? And I recently went to the emergency department with a relative of mine, and the emergency room physician had it. And I asked him, and he said he loves it. It really helps. And he just sat there talking, and the ambient listening tool was listening, right? It was embedded in the EMR. So it's ironic that this is going to be AI, and here's where AI can help, right? AI can help by reducing the burden, the administrative and documentation burden um, that a patient, uh, that a clinician, especially primary care physicians, have to go through, so they can get more time to answer a patient's questions. Um, sometimes you think, these AI tools can field tens of thousands of questions instantaneously, right? And give maybe canned answers. I don't know how I feel about that, right? Because it doesn't have the context of the patient's chart. It doesn't know what the patient is taking or what they have or where they were. But the problem is if the physician has 30 notes to write and then 50 messages to answer and 50 lab results to review and then um, that's there's not enough time in the day, and it's not fair to have them go home and do it at home and take away their family time. Even though so many primary physicians do just that, they take their work home and they work on what's called quote unquote pajama time right after, and that leads to burnout. Well, one of the beautiful things I love about being an intensivist is that I try to make it so that when I'm done, shift is over, I'm done, I'm out, I'm walking out. I don't have documentation to do. I don't have billing to do. I don't have anything to do. Some days, most days, I'm able to do that. Some days I'm not. But if it's every single day, you're working 3 hours at home, that's what leads people to burn out, right? And if you're burning out good docs, that's a disaster for the healthcare system. So number one, health systems have to figure out a way to reduce the documentation burning. Ironically, maybe leaning on AI tools, right? Um, uh, I hesitate to say this, and I think patients also need to understand a day in the life of a primary care physician. I'm not a primary care physician, and I know my doc is super busy. My primary care physician, he has he had in his practice. Some other physicians left, so he has more patients to take care of. Um, he has all these notes to write and all these messages to respond and all these things. It takes time. Please understand that the doctor is not ignoring you. The doctor is inordinately busy, and he wants also some time away from work to be with his family. There's a great sensible medicine post by Dr. Adam Seafiu of the University of Chicago where he gives us a window into this issue, is that sometimes he just can't get to all the messages, right? Because he wants him time. And I don't begrudge him for it, and God bless him for it. And so I think there should be a little bit of modicum of understanding on the part of patients about how busy and difficult they are. Um, Another thing, we physicians, we, again, when we are answering messages, I know we're so busy with time, but we have to understand that a lot of times we fail versus the chatbots. The chatbots are way more empathetic. We should start working on trying to become in our messages more caring and empathetic, right? So that patients are not motivated to go to a chatbot, right? They'll wait a day or two to get a beautiful, compassionate, caring answer from their primary physician. I'd much rather have the answer from my primary doc, who I know and admire and enjoy having him care for me, rather than just some LLM, right? Um, and so doctors have to understand. Another thing, physicians also have to understand that increasingly patients are going to come or will have already asked a chatbot. They're going to just like my friend Eamon did. He told me that his daughter accidentally took an extra dose of her immunosuppressive, and he already asked Claude before he called the fellow, and the fellow was wrong, right? We get that's we have to expect that, right? And we have to be careful not to roll our eyes when they pull out Medscape, like now, or Medscape or WebMD. Well, in the future, they're going to pull out ChatGPT or Claude, right? Or Grok, and they're going to say, "Yo, this is what this says. What do you say?" And if we shouldn't be threatened by that. In fact, if I'm saying, "What do you say?" If I'm asking my physician, "What do you think?" That's because I value your opinion. If I didn't ask you, "What do you think?" then I wouldn't. I just, okay, this is what ChatGPT said, and like this article pointed out, and there's actually research. I think it was Oxford. Yeah, here I'm reading it from the article. Quote: At Oxford University, AI researchers recently tried to determine how often people could use chatbots to correctly diagnose a set of symptoms. Their study, which has not yet been peer reviewed, found that most of the time participants did not arrive at the correct diagnoses or the appropriate next steps, like whether to call an ambulance, unquote. And what's worse, continuing in the article, quote, many patients are aware of these shortcomings, but some are so disillusioned with the medical system that they consider chatbot use a risk worth taking, unquote. Oh, like, wow, guys, like this is a problem. They may get better in the future. And at the same time, we have to understand that these things are not perfect and they can make big time mistakes. So we need to know that this use is out there. We shouldn't be threatened, and we should um, just be aware and say and just look at what they say and they say, no, here's what I think. And maybe you use your own tool trained on an LLM that's trained in a medical context and say, well, let me show you the literature here, and not be defensive, right, about it. So, this article kind of made me think a lot, which is why, I wanted to have this episode, but we have to have solutions um, to fix this problem, because otherwise it could get so much worse. Thanks so much, guys, for your time and attention, and I'll see you next time on Healthcare Musings. Thank you for listening. Sign up at healthcaremusings.com to get every episode delivered directly to your email. And please don't forget to leave a 5-star review. Thank you so much.